UVEA-IXA study is a study which has been conducted in several countries. It's a prospective and retrospective study. Patients were on an early access program using ixazomib in combination with Refdex. The inclusion criteria were 1 to 3 prior lines of therapy, and the median age of the patients was 64 years. Actually, 309 patients have been entered into this study. And the main primary objective was, first of all, to look at response rates and to look at progression-free and to evaluate progression-free survival, also in relation to prior lines of therapy. And the comparator to this study in real-world clinical practice was, of course, the Tourmaline one study, which compared ixazomib Refdex with Refdex in a prospective randomized trial. So this is a trial which a study which reflects a real-world clinical practice, and of the 309 patients who have been enrolled, 22.2% achieved complete response, 24.6% very good partial response, and 33.9% partial response. So actually there was a relatively higher response rate in this patient cohort. And when you look at progression-free survival in all available patients, including those with 1 or 2 or more prior lines of therapy, median progression-free survival was 15.6 months. And when you then ask the question what the difference between those with only 1 prior line of therapy compared to those with 2 or 3 prior lines of therapy, yes, there was a marginal difference. So, of course, as expected, if you have only 1 prior line of therapy, you are in obviously early lines of therapy, and when you are then entered on a protocol, on the IXA Refdex protocol, those patients, you do better, of course, and the median progression-free survival in those patients was 19.6 months, and those with 2 or 3 prior lines of therapy had a median progression-free survival of 13.9 months. So these data are quite, I think, impressive. The treatment, as you all are aware of, is relatively well tolerated. Ixazomib sometimes causes gastrointestinal adverse events, but these can be handled easily by those adaptations. And the outcome of this trial compares relatively well with the results of the Tourmaline 1 trial, where patients were studied in a randomized fashion under clinical study conditions. And of course, those patients did slightly better, both in terms of response rate and in terms of overall of progression-free survival. But actually, there was no big difference. So in other words, what has been observed in the clinical trial can be reproduced in the real-world clinical practice.